warm welcome to Flight TITD Conversation Hour. We call it the Evening Conversation. Being a Wednesday, we talk about matters health. So you want to stay here because today we are talking about hypertension. You need to know about it. Maybe somebody in your family has it, yeah, and you need the information to know how to deal with it. Then you are in the right station at the right time, and we'll be discussing about this in just a short while when we invite Dr. But before then, some of the headline news stories that we've been looking at today. Kenya launches world's first child-friendly TB drug. And in other news, retired teachers hope David Maraga will end 18-year pay row. And Martha Karua calls for speedy exit of IEBC commissioners. Further field Tanzania Magufuli fires officials over fake earthquake account. And in the sporting arena, Kenya to host Africa Hockey Club Championships. Those are some of the headline stories that we've been looking at this very day. You want to stay here for the discussion, and as always, we invite your questions and comments as regards the topic of the day as we are looking at hypertension. The SMS line is 22316, or you can WhatsApp on 0786 316 316. Right now, we have music for you, and this is from the Catch of the Week album that is being sold at TuneIn Music Shop, Yaya Center. You need it. You need to buy any other music, and then you get the Catch of the Week album at a much discounted price of 595 shillings instead of 995. You are listening to Family Radio, the station where the music does the talking, and you're also receiving us live on Family TV on Flight TITD. This is the day on this fine Wednesday evening. You are joining us on Health Matters, and today we are looking at hypertension. You might have heard about it. You wonder, what is hypertension all about? We have our guest in studio who is a doctor. He's going to share with us more about this. His name is Dr. Jeff Athanasio, and he has great insights on this. So, karibu daktari.
Yes, Alvan.
This is Jackton. Alvan leo ameingia chini ya maji.
Yes, that's our pleasure.
All right. He's not feeling well, but I saw him somewhere, meaning that he's getting better and better. Now, let's get at least an overview of what hypertension is.
Basically, hypertension is increased blood pressure, whereby your blood pressure is excessively high, and it has some demarcations. So if your blood pressure is high based on the contraction and the relaxation rate, and you have consecutive readings that shows your blood pressure is high, it means you are hypertensive. Mm-hmm. But there are categories of hypertension. Mm-hmm. Yes.
So you talk about a time the pressure is high. There's also a time meaning that the pressure can be normal.
Yes.
And then there's a time pressure can be low. Let's start with normal so that we can go to high and low. Let's start with normal. Normally, the blood pressure is supposed to be at where?
Okay, we have something called systolic and diastolic blood pressure. Mm-hmm. The contraction rate is the systolic, the relaxation rate is the diastolic. People say the upper reading and the lower reading in layman terms. Between 100 and 140 are within normal range. And in the lower diastolic, between 60 to around 90 is the normal blood pressure. Mm-hmm. So anything above 140 to 90 is regarded as hypertension. Mm-hmm. That is subsequent readings for like 7 days a week. Mm-hmm. Yes, something called serial blood pressure monitoring. Mm-hmm. Yes.
So how is this done? Using a certain machine, device?
Well, actually to diagnose it, you actually need to be checked blood pressure regularly. One reading is not enough. So at least 2 readings or 3 readings in a span of 3 minutes in between, or even 30 minutes. Yes, the machine is called a sphygmomanometer. Mm-hmm. Yes.
I don't know if I can pronounce that. But
basically, it's just a blood pressure machine.
Blood pressure machine.
Yes.
All right. So when the blood pressure is low, what are we talking about?
Hypotension.
Hypotension.
Yes. Mm-hmm. And today it's hypertension. Mm-hmm. Yes.
All right. So what are then the causes? Because somebody may ask themselves, what causes hypertension?
Well, the causes vary because we have predisposing factors and risk factors. We cannot actually pinpoint one major thing that is causing hypertension. Because remember, it's a series of blood pressure readings that shows you have hypertension. Okay, so if I may start with some of the factors involved: cigarette smoking, alcoholism, obesity, high salt intake or high salt diet, genetic factors, and we also have some diseases which can cause secondary hypertension. There are so many factors: drug-induced hypertension, painkillers, steroids. We have diseases. We have people who have kidney problems, diabetes. They are predisposed to having hypertension or associated with hypertension. But mostly, in essential, hypertension is purely and strictly lifestyle related. Yes.
So could you then give us the types of hypertension? Because from the look of things, there are some may be caused by cigarette smoking. And you mentioned there salt and sugar. You mentioned a little bit more about that and elaborate, because a friend of mine is used to taking a lot of sugar and a lot of salt, especially. You just give them food. And even before testing, we ameshaanza kuongeza salt. So you can tell us maybe the different types of hypertension and how they are caused.
Well, we have categories. We have stage 1, stage 2, and stage 3 hypertension. But that is classified based on the readings, where you have moderate hypertension, severe hypertension, and you have pre-hypertension. Okay, those ones are based on the blood pressure machine. But we have primary hypertension and essential hypertension. Now, the primary hypertension basically are caused by the factors like obesity, overweight, lack of exercise, sugar intake, cholesterol levels that are high, diabetes. Then we have essential hypertension, whereby basically you have factors like kidney problems, liver problems, pancreatic problems, or even part of your blood vessels in your heart, exiting from your heart, are actually causing a contraction, or they're causing obstruction. Hence, you may have increased blood pressure. Because remember, blood pressure is the force required to eject blood from your heart. Yes.
Now, maybe you could mention the symptoms, because we're talking about high blood pressure here and there, the hypertension. What are some of the symptoms that one can experience?
Well, the symptoms they vary. You cannot actually use 1 or 2 or 3 symptoms to actually say you have high blood pressure. Because sometimes you may experience palpitations whereby your heart is beating frequently. We also have dizziness. We have headaches. We have chest pains, we have chest congestion, difficulty in breathing, and in some people, those people who actually snore a lot, you may have something called sleep apnea, which can cause hypertension. So the symptoms vary across the board. Hence, a physical exam is very, very important. Yes.
So how often do you encourage somebody to go for the test? Because others may suspect they have after looking at some of the symptoms that you've said. How often should somebody go for a test?
Well, actually, going for blood pressure test, blood pressure is a routine. Whether you have malaria, be it typhoid, whether you have a stomach problem, or whether you have a headache, as long as you enter or you go for medical evaluation, a blood pressure is mandatory. It's called a vital sign, okay? And that's where some people may be actually walking around with high blood pressure, but they don't know. So they end up taking a headache to hospital and to be told you have blood pressure after a series of visits, okay? So it's actually should be a routine each and every time an individual feels sick. So it's not, it doesn't have time frames. You can do it daily, you can do it weekly, based on how your blood pressure is. Yes.
All right. You just mentioned the causes and some of the symptoms that we need to look out for, and then the importance of going for the tests.
Yes.
Very, very important.
Yes.
Now, maybe let's now look at the lifestyle, because predominantly you say hypertension is as a result of our lifestyle.
Yes.
Now, what about our lifestyle should we look at?
Well, it cuts across the board from the time we wake up, the diet you take in the morning, exercise, water intake, hydration, checking our weight, physical activity, because we have people who do not exercise, pressures of work, environmental stresses, because even stress can cause you to have high blood pressure, anxiety attacks. We also have a lack of sleep, poor diet. So basically, in terms of lifestyle, we need to, first and foremost, is to stop the culture of over-the-counter medication. You have a sore throat, over-the-counter. Your sore throat can lead to a heart problem called carditis. Hence, you may have a high blood pressure, secondary hypertension. You have malaria, over-the-counter drugs. You don't go for a test. You have a UTI or an STI, over-the-counter drugs. So you find that the culture of over-the-counter drugs, you may actually have a heart attack as a result of high blood pressure because you've never gone to hospital for even a blood pressure check because you have a headache. Another aspect of lifestyle is what we eat in the morning. Like, for example, your breakfast. How is your breakfast?
You want me to spill it all? I'll say, okay, simply tea, bread, maybe a fruit. That's scarcely, but basically bread and tea. Yes, that's most cases. But when I try, I go for porridge.
Yes.
And maybe bread. That's how I can do it.
Now, bread, we actually encourage brown bread because it has high fiber diet.
I do that.
Okay. Thank you.
I don't
You're
like
justifying
white
yourself.
I don't like white bread. That's the truth of the matter.
Okay.
Yes.
So we have people who actually put in their plates, like in the morning, sausage, bacon, egg yolk. Those factors have got high potassium, high fat intake, and etc., which predispose you to having high cholesterol levels, which may actually clog your blood vessels. So once your blood vessels are clogged, it means the force required to eject blood pressure, to eject blood to your body system, will be required more. So the more you take that kind of a breakfast in a long duration, you're predisposing yourself to blood pressure. So that in itself needs to be changed in terms of diet. The other thing is processed foods. Nowadays, there's so many processed foods over the counter. You go into a supermarket, you get yourself ready-made processed foods. They throw in a lot of potassium, sodium, salt, and even sugar, chocolates every now and then, carbonated drinks like sodas and etc. We are saying that we do not tell someone to totally eject them from their diet. No. Moderation and regulation. But you find somebody takes bacon in the morning, sausage, and eggs without even removing the egg yolk. At around 10 o'clock while at work or wherever he may be, he takes a cup of tea with maybe toasted bread, white bread, a lot of sugar in it, 3-4 spoons and above. Around lunchtime, fried chicken, fried chips. Around 4 there, probably they might skip it because they were full, but some do take a lot. In between, they snack it with some candy or a chocolate. Then in the evening, they're back to like deep fried foods and etc. Then probably they don't sleep well. So you find by the time you accumulate it to around 6 to like 10 months, they have symptoms of high cholesterol in their body system. So the blood values rise to some degree. After some time, headache, stomach aches, chest pain, dizziness on off, easy fatigability. And this individual lived a sedentary lifestyle. So lifestyle is very, very important in managing blood pressure. Yes.
All right, we'll be looking at your questions. If you have a question, you have a comment as regards today's topic. We are talking about hypertension, high blood pressure. And if you have any question, of course, you send it to 22316 or you can WhatsApp on 0786 316 316. We'll also be looking at how to manage high blood pressure, because from the look of things, I believe there is hope. All is not lost. You want to stay here for that? Dr. Jeff Athanasio will be highlighting more on that. But right now, we'll listen to music. We'll be right back. today we are zeroing in on high blood pressure, hypertension. Yeah, that's hypertension. And there's some things that you really need to know about hypertension in case people have been telling you that hypertension, maybe it's for the old, I don't know, for those who are obese and so on and so forth. In just a short while, Dr. Jeff Athanasio will be giving us some of these misconceptions. Then give us the bright light, the insights that we need to know about. Kidogo, I read a message here from Kevin from Limuru saying, what a show. Thank you so much. And say, if I may ask, the age bracket for one to acquire high blood pressure or hypertension, because I'm 24 and have those symptoms that you've just mentioned. This is Kevin. Well, you feel free. You can send your message to 22316 or you can WhatsApp on 0786 316 316. Now, Dr. let's deal with the elephant in the room, as they say. Hiyo mambo ya misconceptions, what people say about hypertension, which is not true.
Well, people say hypertension basically is a disease of the old. And nowadays we see, based on the lifestyle that we're living, that you talked earlier, it cuts across the board. So we cannot say it's a disease of the elderly and the old. At the same time, people say hypertension as long as it's not in our family, because it's genetic. It's a predisposing factor. People say that it actually it cannot affect them in any way. But if you consider the lifestyle that they're living in, actually predisposes them and put them at risk of having hypertension. Okay? And we also have, like I said, it can cut across the board. We have, you find people who are around 18, 17, 21, sometimes even 14 or even 10. Because remember, we have secondary hypertension, frequent monitoring of blood pressure, which is high. Secondary hypertension could be having an underlying disease, which can actually lead to hypertension, and hence having symptoms of hypertension. On the question regarding Kevin asked, he asked that based on the fact that he has those symptoms, he thinks he has blood pressure. No. The only way to come up with high blood pressure or hypertension rather, because remember, your blood pressure may be high on one occasion. Okay, and there are people who have something called white coat blood pressure, whereby you enter a facility. Now, because they're taking your blood pressure, you're anxious, so your blood pressure goes up. Okay, we cannot use that one value to say that you're having hypertension. We can say your blood pressure is high, hence we need to find out the causes. Sometimes it could be anxiety, sometimes it could be some stressing factors and etc. Of which those people, when you find them in the society, you take a blood pressure randomly, the blood pressure is normal. So the best way to actually know if you have blood pressure or hypertension is through your history in terms of lifestyle and physical activities. Then when you go to a facility or health facility, the health practitioner ought to take your history and actually do a physical examination on you. Then we have tests, basically to check out your kidney function test, your sodium levels, potassium levels, glucose levels, basically to rule off any secondary factors. So it does not mean you have hypertension, because remember, malaria can give you those symptoms of hypertension because you have a fever. So your heart is trying to compensate by pumping out blood faster. So it does not mean you're having hypertension. So those are some of the misconceptions here and there.
All right. Yes. Let's look at yet another question here. This time round it's from Louis. Louis says, hi Family Radio and Dr. Jeff. My name is Louis from Dagoretti. My mother, who is in Kisi, recently started having heavy breathing after walking some short distance. She is an active farmer and she eats clean. Chakula reserve.
Yes.
Is there any chance of hypertension? She also experiences headaches, but she takes tea and she gets fine. Please advise Uyuni Louis from Dagoretti.
Well, living a healthy lifestyle, like I said, it does not mean that it does not guarantee you from not having high blood pressure or hypertension. Her mother is having a symptoms of hypertension, difficulty in breathing after physical activity. there are two organs that are involved there. That means your heart and your lungs. Okay, so for you to have difficulty in breathing, you either have a lung problem or the part where the heart and the lungs exchange oxygen into the blood. There is an issue there. So you may have something called compensatory hypertension or decompensated hypertension, whereby you're having actually a heart problem. You're not, you don't have any other causes. Your lifestyle is okay, but you're having a heart problem. Some people may have a congenital heart problem that may drag them for a very long time. Okay, then you actually fail to go to a health facility and your heart doesn't get checked out. Because remember, we have factors like ECG, which are actually used to check for heart issues. So I will advise her she should go to her nearest health facility and get a heart evaluation and a lung evaluation. Yes.
All right. And we carry on with today's conversation, the evening conversation. We're talking about hypertension. If you like high blood pressure, if you've been wondering if these two are different things, they're different entities, they're just one and the same. High blood pressure. And then you talked about hypo, which is low blood pressure.
Yes.
Then there's also normal blood pressure. Then there's also that other issue of misconception as regards some people who may be as lean as I am or slim, saying that mimi siwezi kuwa na high blood pressure. Is it true or is it a misconception also?
Well, that is a misconception because remember, you may be slim, but you are on chances are in your history, social economic history, you may be having a vocational or occasional drug intake, like for example cocaine, for example antidepressants, or addicted to painkillers. Hence, by virtue of their content and their toxicity and how they change your physiological function, you may start having withdrawal symptoms, where basically your heart starts beating because of lack of it, and etc. So it does not guarantee you that the fact that you're slim, you may not have high blood pressure. Okay, you may be having the genetic predisposition that predisposes you to having high blood pressure, but you actually have other factors which contribute to it. Yes.
All right. And we just want to head to the treatment and maintenance of high blood pressure. In just a short while, we'll be looking into that. In case you have a question or a comment, we still welcome them on 22316, or you can WhatsApp on 0786 316 316. have that confidence in God, knowing that He is with us. Well, you are listening to Family Radio, the station where the music does the talking, and also watching us on Family TV today as we tackle on the issue of hypertension, otherwise known as high blood pressure. And with me in studio, I have Dr. Jeff Athanasio, and he's giving us some insights on this. And before I go back to your questions, maybe we look at the treatment and
Of hypertension.
yes, and how one can manage a person who has hypertension.
There are several drugs or categories of drugs or classes of drugs that are used to manage hypertension. And it's basically entailed or classified around your blood pressure rate, your type of blood pressure or hypertensive case, and other secondary factors. In some cases, you treat the causative factors, and the blood pressure subsides. And in some cases, let's say, for example, if your blood pressure is in class 1, whereby your contraction rate is between 140 and 90, sometimes we are actually not in a hurry to put you on antihypertensive. Okay, we put you on DASH diet, that is diet approaches involving stopping hypertension, or a lifestyle mode or exercise mode. Then we monitor you for like a week, whereby you take serial blood pressures when you're at home, such that by the time you're coming into the next visit, we are capable of actually taking an average and seeing if you're a candidate for medications or not. So we have, in that category of 140 to 90, we have like a one-type set of class of drugs, okay? Then the other category of around 180, 160 and above to around 189, and also 90 and above to around 100. We have also two sets of categories of drugs. They have medical terms, and they're basically four major things in treating hypertension. You give something called a calcium channel blocker, whereby calcium reduces production of something called calcium from your heart. Okay, we have something called beta blockers, which basically reduces the contraction rate, and we have factors called AC inhibitors. Basically, they reduce some components into your heart from being produced. Then we have other factors that may actually predispose you to having blood pressure in your heart, like high cholesterol, high fatty diet may cause cholesterol into your body system. So in that case, we give drugs which lowers your cholesterol. Okay. Then we also have secondary factors, like if you have a goiter or if you had a thyroid problem, may actually predispose you to having hypertension. So before one is put on antihypertensives, okay, one needs a thorough evaluation. The mistake most people do is that once they were told they have a high blood pressure and they've gone to a facility once or twice, some stop the medications on their own because they were told now the blood pressure is stable, okay. Some go over the counter because they were given this medication the previous visit to a hospital. They go over the counter without even checking their blood pressure. They take antihypertensives. Okay, so that is basically the way of treatment. And treatment is focused on your type of blood pressure or hypertensive case. Is it a secondary hypertension? Is there an underlying factors, or do you have a heart problem? Yes.
Now that you've mentioned about the issue of treatment, is there a special diet for somebody who is diagnosed with hypertension?
Yes. Diet is mostly part of lifestyle. There's something called DASH diet. DASH, basically DASH, means dietary approaches in stopping hypertension. Okay, it is a diet whereby you don't have to be hypertensive for you to adapt it. You can actually adapt it even before you've been told you have hypertension, especially if you have you're a high candidate, or if there's a history of hypertension in your family, or if you have a secondary factor. Basically, the aim of this diet is to try and reduce high calorie intake, to try and reduce fats, to try and reduce sodium, potassium, and also to help your body system strengthen in terms of your blood vessels. Because remember, if your heart is struggling so much to beat, okay, that is the force required to pump blood, which contains the nutrients, into your body systems, your organs, and your cells, essentially, and even body repair. So the diet in itself creates an environment or a physiological system whereby your body system or your blood vessels, because remember, the problem could not be your heart. The problem could be away from your heart, whereby you're now having cholesterol or a fatty liver. For example, those who like eating barbecued meats, nyama choma, those who smoke cigarettes, those who take in a lot of alcohol, those who take in a lot of chocolates, a lot of yogurt, a lot of even maziwa lala, a lot of milk that has got high content of fat. You know, people just go into the supermarket or the shops, they take a product without even reading the content. They do it so frequently. And remember, these factors increases your chances of having hypertension. Because like in the category of drugs, you've heard about calcium, you've heard about sodium reducing agents. So salt in itself should not be part and parcel of your diet. Okay?
So eat food without salt, or what are you saying?
I'm saying if you're hypertensive, okay, you actually need to see a nutritionist to actually tell you the number of pinches of salt that you need to throw into your food.
Pinches?
Yes. And the add-on salt is usually different, okay, from the salt that you add after you've cooked your food, okay? Then we have other factors like barbecued meat or fried meat. Fry this, fry that, every now and then. They actually predispose you to having high blood pressure, which frequent number of times can cause hypertension. Yes. Another factor is high vegetable intake. If you have high vegetable intake, it actually reduces your risk factors. It actually reduces your chances of having high blood pressure and essentially hypertension. Another factor is lack of water intake. Water is life, okay? It actually, a solvent, it dissolves so many factors and helps you excrete waste from your body and etc. It cleans your kidneys. There are more than 30 functions of water, okay? It's like trying to in layman terms, okay, to put porridge in a pipe, whereby it is being pumped from a generator or compressor, or you put water in a pipe. Okay, which one will flow faster in your view? Water, exactly. Yes. So if your body is full of toxic substances, alcohol, the fried chips and chicken, processed foods, you buy chicken, you don't remove the fatty layer and etc. You add oil, which is not vegetable oil. You're in a rampage of lifestyle and etc. You have sleep apnea. Of course, your heart will have a problem pumping your blood, because the blood is like the porridge in the pipe in layman terms. Then when you take in water, it's a natural solvent. It's easy for your heart to pump. Okay, so water is part of diet. Yes.
Daktari, kuna maswali hapa. I hope you will tackle some of them, because others tutaangalia. Now, here is one from a friend who says, "Hi, I love the topic. I am a victim of high blood pressure. I've tried to lose weight by avoiding to eat so many foods, but my weight doesn't cut. Should I stop eating at night?"
Well, dieting, first and foremost, is not a way to reduce weight. A lot of people, those who are having obesity, because you know there are classes of obesity, they struggle losing weight as a result of being told they risk high blood pressure and etc. So they skip meals. I wouldn't advise her to actually skip meals. I'll advise her to see a nutritionist and dietetics to actually come up with a diet plan. Okay, and if I may ask her, there's one factor which people actually ignore, and it's a factor which is always in their foodstuffs. Frying foods, putting oil in your food, be it skuma wiki. One might say, I eat vegetables, but they put a lot of oil in it. It's a daily factor. It's a daily factor that may take years, hence may building up your cholesterol in your body system. So she may be struggling to lose weight, but she has something called negative energy in the body system, whereby you're eating, yes, okay, you're eating healthy, yes, you're observing everything as per the prescription of stopping hypertension, yes, but you have a sedentary lifestyle whereby you're not active. You're from the house, you wake up, you eat healthy, you enter the car, you drive to work, you sit, and that's a routine. You do not exercise. So there's something called glucogenesis, whereby the food you eat is converted into glucose. Then at the same time, it is required for energy. But if you're not active, the energy itself is stored in form of fats. The fat in itself, it's called adipose tissue. Okay? So you find that you're expending less, but taking in more. Yes. So dieting is not the way. Yes.
Now, Daktari, we'll tackle one more question here from a friend who indicates that I've gone for ECG and ECHO, I believe, and I was echo,
yes.
and result was negative, but I was put on hypertension drugs. Why?
Well, is it a he or she?
Wycliffe.
Wycliffe has actually given us the investigative part of it, which he should thank God he doesn't have compensatory hypertension or heart-related hypertension. That means he has basically essential hypertension. So it means his heart is functioning okay. Because remember, the ECG in full means echocardiogram, which is basically used to see the waves on how there's something called action potentials. They basically show us the rhythm of your heart. It's called an ECG. Then the echo, it's an echocardiogram in full, which shows us the chambers of your heart, because the heart has got 4 chambers and it has valves in it. Okay, so if they were normal, he should actually thank God that he has actually a clean bill of health in terms of the main pump that keeps him alive. Okay, so he was put on blood pressure drugs because he has essential hypertension, and that means basically he may be having other predisposing factors like genetics, okay, which are making him have hypertension. And he has not told us the type of hypertension or the class of blood pressure readings that he was having. He has not told us his age. He may have a normal heart rhythm, a normal heart chambers, but because his blood pressure was up, he was put on antihypertensive. The doctor maybe has not told her or he has not told him about other factors that may be causing blood pressure, like evaluating of other systems, evaluating of lifestyle, stressors. Even stress can make you have high blood pressure if it's prolonged. Anxiety, cholesterol, because we have not checked his BMI and etc. His lifestyle, what he eats, maybe he adds a lot of salt, maybe he takes like 4 or 5 cups of sugar, maybe he's diabetic. So
these are some of the things you should think of. Well, Daktari, we have 60 seconds.
Yes.
You just give your parting shots. I know we will invite you yet another time to continue. You told me this subject is so broad.
Yes.
So with these 60 seconds, what do you have to share with us as your parting shot?
Well, if you have any medical symptoms, even a flu or a cold, okay, even a stomach problem, it is not wise to just ignore and go over the counter. Go to a facility. A vital sign, which is basically your blood pressure check, is a mandatory test, regardless of what takes you to the hospital. It is a mandatory test to every health practitioner is supposed to take. So that small blood pressure reading is enough to tell us more about high blood pressure. It is the only way you can tell if you have high blood pressure or hypertension. But you cannot diagnose hypertension based on symptoms. Yes, because remember, it also has its complications. Yes.
All right, Daktari, we'll continue this conversation. It's getting very, very intricate. We need to find out more of those things that you need to share with us. Well, that's just about it on today's evening conversation, which we were hosting Dr. Jeff Athanasio, who shared with us great insights on hypertension. That's it on Flight TITD. You have yourself a blessed evening, and thank you so much for joining us. Tomorrow, God willing, we meet from 3:30 on radio, then on TV from 6 to 7. God bless you. My name is Jack Tonamusi.